The final few seconds before you look away can shape the next few hours of your dog's behavior. In that tiny window, most owners accidentally turn an ordinary stare into a training problem, a stress loop, or a missed health warning. You notice it in the quietest moment. Your dog is lying down, eyes locked on you, body still. The room feels like it is holding its breath. You think you are being kind by responding, but your dog does not understand kindness as a concept. Your dog understands patterns and outcomes. The golden rule of reading the stare is this: you classify before you comfort. You scan the body first. You look for soft eyes versus hard eyes, a loose jaw versus a tight mouth, ears neutral versus pinned, tail still versus thumping, weight relaxed versus shifted. Then you classify context. You check the time of day, recent exercise, recent feeding, new visitors, and sudden noises. Veterinary behaviorists like Dr. Karen Overall emphasize that attention can function as reinforcement, even when you think you are just being polite. You can hack this system by treating your response like a training representative. You imagine you answer one stare with snacks, petting, or a door opening. By the time you do that 3 nights in a row, you have trained a nightly appointment you never scheduled. You are about to learn 9 real requests hidden inside that stare, and you will answer each without creating a problem. Once you read the body and the context, you stop guessing and you start sorting. Now you move into the comfort stares, where your dog is not bargaining, just regulating. First, you see the proximity ask. You notice soft blinking, a relaxed body, a slow tail, and a head resting while the eyes track you. You respond by inviting calm contact on your terms, using a simple settle cue, then you disengage before it becomes a demand. Second, you see the better resting spot ask. You notice shifting, a long sigh, and a look from you to the couch or blanket, then back again. To fix that problem, you must make the good spot obvious, like a bed away from drafts, and you reinforce choosing it. Third, you see the reassurance ask. You notice ears slightly back, lip lick, and scanning toward a sound, then the stare returns to you. You lower stimulation, you keep the routine predictable, and you give one simple task with a small reward so your dog regains control. Researchers studying the secure base effect show dogs use you as an anchor in uncertain moments, not as a vending machine. Applied behavior sources also flag lip licking and scanning as common stress signals. You think you are teaching independence by ignoring that stare, but your dog does not understand your philosophy. Your dog feels the uncertainty grow, and by the time you notice pacing or trembling, you have accidentally trained anxiety to get louder. You now understand the comfort stares, where your dog is asking for stability. Next are the stares that try to move resources, because your dog learns what your hands and doors can do. Fourth, you see the hunger or schedule ask. You notice the stare, then a glance toward the kitchen, maybe a little drool, then pacing after the stare or checking the bowl. You verify the feeding schedule, you measure portions, and you ask your veterinarian about satiety strategies like appropriate fiber, so staring never pulls dinner earlier. Fifth, you see the play or mental work ask. You notice bright eyes, tiny wiggles, a toy nearby, and quick head lifts while your dog stays lying down. You meet the need with structured enrichment, like short training, a sniff game, or a puzzle feeder, so the cue becomes your routine, not the stare. Sixth, you see the access ask. You notice a stare then glance pattern toward the door, the yard, the couch, or another room, then stillness again. To fix demand training, you must teach an alternative request, like sitting at the door, touching a target, or going to a mat, and you only grant access after that behavior. Operant conditioning experts like Dr. Sophia Yin taught that attention and access are powerful reinforcers, even more than food for some dogs. You can hack this system by making the polite behavior the only behavior that works. You tell yourself you will do it just this once. By the time you repeat that exception a few times, the stare becomes a nightly negotiation, and the negotiation becomes whining when the stare stops working. Comfort and resources explain most stares, and that is exactly why the medical ones get missed. The stare can be a body message, delivered in the only language your dog has. Seventh, you see the pain ask. You notice stiffness when rising, a tucked posture even while lying down, shallow breathing, reluctance to be touched, or a tense face that looks carved instead of soft. You do a quick mobility check, you note changes, you avoid forcing movement, and you schedule a veterinary exam for common culprits like arthritis, dental pain, or abdominal discomfort. 8th, you see the unwell ask. You notice lip smacking, repeated swallowing, drooling, grass eating earlier, or restlessness paired with staring. You monitor appetite, vomiting or diarrhea, hydration, and you call the veterinarian if it persists or feels severe. 9th, you see the overload ask. You notice whale eye, pinned ears, freezing, and a stare that looks like your dog is asking you for an exit plan. You create distance, you reduce triggers, you use a safe room, and you consider a qualified behavior professional if it repeats. Veterinary associations routinely warn that behavior changes can be early indicators of illness or pain. You think you are seeing guilt or stubbornness, but your dog does not perform morality plays. Your dog protects a sore body, and by the time you notice obvious limping, the condition may have progressed. You now have the 9 asks, and you need a repeatable way to answer them without guessing. You pause 2 seconds and scan body signals, soft versus tense. You scan context, food, exercise, noise, and recent changes. You offer one neutral option first: water, a potty break, a bed, or a calm cue. If the stare persists, you test with a low-cost behavior like sit, touch, or go to mat, to separate wanting from feeling unwell. You log patterns for 3 days, and if you see stiffness, appetite change, or escalating stress signals, you call the veterinarian. Behavior science consistently shows that clear, consistent contingencies reduce anxiety and demand behavior. Your dog is not running a mystery novel. Your dog is running a simple feedback system.